Hi, my name is Cameron. I am a benefit advisor at One Digital. I'm going to be discussing the open enrollment for Calance employees. Open enrollment is active from November 15th until November 29th, 2018. All changes are effective on January 1st, 2019. During open enrollment, you can enroll or drop benefits, which means you can change your plans. You can enroll or drop your dependents. So this would be a time of year where you could remove a dependent or add a dependent. You can also change your from different plans. So you can change your medical plans. You can change between one of the two dental plans. There are times outside of this open enrollment period where you can make changes to your benefits. Those are called qualifying life events. The platform that Calance uses is Zenefits. So you can trigger those qualifying life events within Zenefits. There's a flow for that. Some examples would be getting married, having a new child, maybe moving from one state to another that qualifies you for different plans. Open enrollment started on Thursday, November 15th and lasts until the 29th of November. Your medical plans are with Anthem Blue Cross. Your dental plans are with Aetna. Your vision plan is with VSP. Your ancillary plans for life insurance, for voluntary short-term disability, long-term disability, accidental death and dismemberment, those are all with Cigna. And then you have a flexible spending account with TASC, EASC. If you do not change your medical plan, you will have no change to the ID card. So you'll keep the same card if you're keeping the same plan. But if you move to a new medical plan, then you will have a new ID card. For dental, there are no change to ID cards unless you move from the PPO to the HMO dental or vice versa. For vision, the ID card is not needed. VSP, your current carrier, uses a paperless card-free system. You just need to let them know, vision provider know your social security number. They'll be able to find you in the system. Flexible spending account for your healthcare FSA, that's just pre-tax dollars that you put away. Don't forget to spend those down by the end of the year. The new plan year begins on 1/1/19. All right, let's start off by taking a look at your medical plans with Anthem Blue Cross. A couple different options. You have a PPO, gives you the greatest flexibility, moderate costs. There's also an HMO for California members, gives you lower flexibility, lower costs, and you need a primary care physician. So you need a little more walled coverage you have with an HMO. The HMO medical benefits, everybody must have a primary care physician. Again, the HMO plan is only for employees based in California. Your PCP will direct all aspects of your care, will refer you to specialists, will tell you which hospital you can go to for scheduled procedures or surgeries. If you need to see a specialist, they'll refer you. If you are traveling and out of the HMO area, only emergencies will be covered. So if you have an emergency, go to the nearest hospital. But you'll have no coverage if you go outside the network. I advise everyone, if you're on the HMO, the PPO, or even the EPO, to create an account at Anthem Blue Cross's member portal. That way you can search for doctors and facilities in your network. All right, here's the California HMO plan with Anthem Blue Cross. It has no deductible. Annual out-of-pocket maximum is $3,000 per individual. This is the maximum amount any individual would pay on this plan. So in a large claims year, you would be limited at $3,000. Anthem Blue Cross insures everything over $3,000. This number refreshes on January 1st of every plan year. Preventive care visits are no charge. This holds true for all medical plans. It's part of the Affordable Care Act, also known as Obamacare. So your annual physical will be covered at no charge. Annual wellness testing for male, female children, also covered at no charge. The copays to see a doctor are $20. If you're referred to a specialist, it's going to be a $40 copay. Look at pharmacy. It could be either a $5 or a $20 copay for a 30-day supply. For a tier 1 drug, those are most likely a generic drug. For brand name drugs, $40 copay. For specialty drugs, $60 copay. And 30% up to $250 max copay for the specialty drugs that aren't on the formulary list. So these are your newer drugs that are more high cost. You're limited to $250 for those types of drugs. Urgent care is covered at $20 copay. You see emergency healthcare services, it's a $150 copay. You see go to the hospital, it's a $250 per day copay, but limited to 3 days, so $750 max per admission. Any outpatient surgery requires that you pay 20% of that charge. So this is the HMO plan, no deductible, which is nice, and then pretty much defined charges for all other medical services. Let's move on to PPO. PPO gives you a more comprehensive network of doctors, hospitals, and facilities. You can choose any doctor, specialist, or hospital, any facility that's within that network. You don't need a referral. But it's going to be hard to go out of network. Anthem Blue Cross has the largest nationwide network for their PPO plan. So you should be able to go to anthem.com and find facilities in your network. Again, advise making a membership in their member portal. Okay, so the PPO plan, this is for, this is the EPO plan. So we have two plans for out-of-state folks. One is this EPO plan. So if you're in California, you don't need to pay attention to this plan. It's not available to you. So this is the plan that is similar to the HMO benefits, but it's an EPO, and it's for all non-California employees. This plan follows the PPO network, so you don't need a primary care physician, which is nice. You have access to the full nationwide Anthem Blue Cross PPO network of facilities and doctors, but there is no out-of-network coverage, so you cannot go out of network. That's the restriction on this EPO, this exclusive PPO. I guess I should define EPO, exclusive provider organization. All right, so the out-of-pocket max on this plan is $2,500. The co-pays for specialists and regular physician office visits, the primary care physician is $20. Again, you don't need a referral to see a specialist. So the co-pay is the same there. You can see the different tiers of prescription drugs ranging anywhere from $5 to $50 with that 30% specialty drug. Let's look at the bottom. Hospitalization, $250 per day, up to $750 max per admission. This is the same as the in California HMO. And outpatient surgery is $125 copay. So for those who do not live in California, this is the lower cost option. It's a pretty good plan. The reason why it costs much less is because there's no out-of-network coverage. So you're restricted to going in-network with Anthem Blue Cross of California PPO network. All right, this is the PPO plan that's available to all employees. So for those employees in California, this is your non-HMO option. It gives you full access to the Anthem PPO network, which is great. This plan is going to cost more for both California employees as compared to the HMO and for out-of-state employees as compared to the EPO. So this is a more expensive plan. So you have a $500 deductible. So this is an amount that you must pay per calendar year before services are covered by Anthem Blue Cross. Deductible is waived for office visits and retail pharmacy, so you don't need to worry about satisfying the calendar year deductible. The out-of-pocket max is higher on this plan at $3,500. You can see the copay for office visits are $20 for primary care or specialist. Again, you don't need a referral to see a specialist on this PPA. So $20 here, and you don't need to worry about the deductible if you're just seeing the doctor. Same holds true for pharmacy. If you're picking up a prescription drug, you don't need to satisfy the deductible, but everything else must accumulate towards the deductible before Anthem covers it. So if you have any laboratories or scans, x-rays, any sort of testing done, you have to pay the full cost of those services as a member until you reach your $500 deductible, and then the co-insurance kicks in, so that's 10%. So let's look at hospital care, 10% co-insurance after deductible. So if you're admitted to the hospital, you're paying 10%. And for outpatient surgery, you're also paying 10% after you satisfy the deductible. The $500 deductible isn't a per incident deductible. It's all services in the calendar year accumulate towards satisfying the $500 deductible. This PPO plan also has out-of-network benefits. We hope that all members can be facilities and doctors in-network. Again, Anthem Blue Cross is a really large PPO network, but know that it does have out-of-network coverage if you need it. All right, let's move on to dental. Oops, we already had the EPO. All right, so you go to anthem.com/CA to find doctors. If you are looking to switch from the HMO to the PPO in California or from the EPO to the PPO if you're out of California, you don't need to log into your personal account. And here's some hints on how you can choose different physician networks to see which doctors and facilities might be on network. As an Anthem Blue Cross member, you have access to behavioral health, Life Health Online. So that's a new benefit. And Anthem touts their mobile health, so they have an app, which is helpful. They have a 24/7 nurse line. There's a Future Mom program, healthy lifestyles program in the member portal. Yeah, prescription drug home delivery. There's a lot of member discounts as well, and you can see those all in your Anthem Blue Cross member portal. All right, let's move to the dental plans. We have two dental plans with Aetna offered by the company. We have DHMO, so that's a dental HMO, and we have a dental PPO. You can see it on the right side. All right, so on the HMO, depending on where you live, there's only going to be a few dentists that will accept you as a patient. You must have a primary dentist. You can't change dentists. And all dental care must be run through your primary dentist. This plan is a lot less expensive. You can see for all the different procedures that there's a fee schedule, so there's copays for each type of procedure that you have at the HMO plan. For the PPO, there's a full list of dentists that you can choose from. And if you go out of network, there is even payment on the PPO plan. You can see this on the right. So this plan operates, so let's talk about the PPO here. There's a deductible of $50 per individual. There's an annual maximum benefit of $1,500 per individual. This means that Aetna will pay out $1,500 in benefit per member on the plan for a calendar year. That refreshes on 1/1 of every year. All your preventive care is every 6 months is covered. Cleanings, x-rays, exams. So there must be a 6-month gap. You can get the preventive care twice a year. There's no charge for that. Deductibles waived. Basic procedures are 10% member responsibility after the deductible. Oral surgery, root canals are an example. Fillings, those type of things. Major procedures are the bigger ticket items: crowns, bridges, implants, major dental surgery. So those would be a 40% member responsibility. And PPO plan also covers orthodontics, 50% benefit for any member, up to $1,000 lifetime. So that's not that's not a per year benefit, that's a lifetime benefit for ortho. So a little bit of benefit there for you. All right. So here are some examples of the HMO and the different charges. You can look here, and this is all available to you in benefits. You can download this PDF for evaluations, imaging, for your preventive care, diagnostic and preventive. You can see much of those are no charge. And then the charges go up for each dental code. So you can really see different crowns, how much they cost, composite based, how many surfaces, what tooth you're using. Just some examples there. All right, let's move on to the vision plan. We have VSP, which is the largest vision provider in the country, VSP. You have an annual exam for your eyeglass fitting or contact lens fitting. Must be 12 months gap before you can get a well vision exam with $10 copay. There's a materials copay for your frames and lenses of $25. So there's a copay when you pick those up. Lenses you can get every 12 months, so every year you can get new eyeglass lenses, but you can only replace your frames every 24 months. So if your vision changes, you can get new lenses in your current frame. So let's say if it's within the 24-month allowance for new frames. All right, the frames, they'll pay out up to, there's a $130 allowance for most frames, and they have featured name brands, which you can check out on BSP. Nike, Calvin Klein are some examples, and they'll pay out up to $150 for those frames. So your dollar goes a little further there. And then most frames cost more than either $130 or $150. So you have those, $300, $400 frames for amounts above the allowance, you're going to get a 20% number savings. That's nice. You can also get contacts instead of eyeglasses, and you'll have a $130 allowance for contacts, and you're going to have to pay up to a $60 copay for evaluation and fitting of your contact lenses. But if you have medically necessary contact lenses, as in you can't wear eyeglasses, then the allowance doesn't matter. You just pay that $60 copay. All right. Let's look at your added value benefits. You can purchase life insurance through Cigna, and this is all self-administrable on the benefits platform. life insurance and AD&D, which stands for accidental death and dismemberment. You could purchase this for yourself, for your spouse, for your children, and you can purchase 5 times your annual salary, up to capped at $300,000. The spouse's maximum benefit is half of the employees, but cannot exceed 150. And then you can, for each child up to age 19, you can purchase up to $10,000 of life insurance. So the guarantee issue, no health questions are necessary for new members who are new hires, up to $100,000 for employee, $20,000 for spouse, $10,000 for child. If you do elect amounts more than that, then you're going to be responsible for filling out what we see down below here in the fine print as evidence of insurability. The benefits will prompt you to fill out that EOI, and you're going to have to send that to Cigna directly yourself. So a lot of personal health questions will be required to be filled out. They'll go back and forth with Cigna, and they'll let you know if you have are approved for the amount greater than the guarantee issue. If you are, you'll just need to go into your benefits account and say, yes, I was approved for, $250,000, and so that everything can match up in benefits and with payroll deductions. So it's important to do that last step in benefits because they're only going to allow you up to $100,000. So that's just for new employees. If you're a current employee on life insurance and want to increase your amount, then you're going to need to fill out an EOI as well. Let's say you're approved for $50,000 right now and you want to bump it up to 100, you're going to have to fill out that EOI and go through that health question process. Or if you didn't elect life insurance when you were first hired and you want to elect it now, you'll still have to go through that EOI process. So fair warning there, it takes a little bit of effort. It's not approved right away, but if and when you're approved by Cigna, then you're effective on that day moving forward. So you'll just need to update benefits to make sure that the system of record knows how much life insurance you have. Right, there's also short-term disability that employees can buy, which protects 60% of your pre-disability earnings up to a max benefit of $1,385 per week. You have to be sick or on leave for up to 7 days for either accident or illness for the benefit to begin. So this benefit can last up to 25 weeks. So after short-term disability, if you go through that and you're still not able to return to work, there's also long-term disability. It's a separate policy to purchase. And this covers 60% of your pre-disability earnings up to a max benefit of $8,000 per month. And this benefit lasts until Social Security normal retirement age or age 65. So that will cover you until retirement age and will compensate your pre-disability earnings 60% to cap at $8,000. This benefit kicks in after 180 days, so 6 weeks. So it picks up, 6 months. So it picks up where short-term disability ends. All right. Reminder about your pre-tax benefits with FSA. This is not administered through benefits, so contact Calance HR to understand about TASC, T-A-S-C. Let's talk a little bit about TASC. Let me see if I can go to the previous slide. Apologies. So TASC allows you to, all right, so the FSA allows you to elect up to, actually this was just changed, it's $2,700, so not $2,650, $2,700 for healthcare spending account. This is taken out of your paycheck pre-tax, and that amount is available to you on day one. This FSA for healthcare begins on 1/1, and you can use it for unreimbursed medical, dental, vision expenses. Some examples of eligible expenses you see here in the chart: copays, deductibles, co-insurance, office visits, prescription drugs, vision care. You can put it towards LASIK, vaccinations, and there's a whole website there at taskonline.com where you can find the eligible FSA expenses. You can also go to help.benefits.com, and they have a whole list of items that you can use for healthcare FSA dollars. So if you know what you're going to spend for healthcare to pay those copays, those charges, those out-of-pocket charges, you can put it away pre-tax. Know that it is use it or lose it, so those rules do apply. So if you don't use that amount by the end of the year, then those funds left over in the healthcare FSA will be sacrificed. All right. So FSA also has dependent care, and you can put away up to $5,000 per year for dependent care. It's for your children age 13 and younger. Both parents must be working or looking for work or going to school full time to be able to contribute to a dependent care account. Dependent care FSA can also be used for elder care, so to pay for the care of elders, nursing homes, and such. So you put away $5,000 pre-tax for that as well. All right, so how do you make plan elections? You want to log into your Zenefits account, and you can make all those plan elections. You'll be able to read your materials and understand what your monthly contribution will be. If you add dependents, or if you remove dependents, what that monthly cost to you will be. Change and update your address, make sure your life insurance beneficiary is up to date, add or term dependents, change your benefits from one plan to another, maybe go on dental, remove dental, jump on vision coverage for the first time if you'd like. So all these things you can do in benefits during open enrollment. You don't really need any necessary forms for human resources aside from what they'll update you on for the FSA, for healthcare and dependent care. But you need to make your choices, by Thursday, November 29th. And changes are effective January 1st, so in the new year. All right, log into Zenefits to make that happen. I'm sure you know how to go to zenefits.com and log into the portal. And there will be a lot of plan documents and benefits as well if you want to deep dive on any of the plans. You can contact for help. So you have your HR team. We also have a client advocate center at One Digital. Again, One Digital is your broker for Calance, and we have our client advocate center. You can see their 866 number there, service@onedigital.com, so they can help you out with any questions that you might have. Their information also displays when you log into the benefits, so I'll try to make it easy for you. If you have any of those specific questions during open enrollment, they're there for you. All right, reminder about AFLAC. This is also done offline and not in benefits, but they have a bunch of different programs. Let's see here, sorry. An accident plan, a cancer plan, a hospital plan, and short-term disability plan. So contact HR if you have questions about AFLAC or want to enroll. There is a form that you can fill out if you have interest in the AFLAC products, and they'll contact you to go through a one-on-one meeting. Here's Daniel's contact information. So should you want to enroll in AFLAC, he works for AFLAC and is your company representative. All right, that's pretty much it. Thank you very much for attending the webinar. Have a good day.